Hello. Today I'm going to discuss somatic symptoms disorder and dissociative disorder, otherwise known as DID. Somatic symptom disorder is characterized by focusing on physical symptoms. For example, patient might complain of fatigue, pain, to the excessive concern that they are excessively concerned and preoccupied with fear about those complaints, symptoms that they have. Their suffering is usually genuine, and they can have like functional impairment, like being blind. They can have like not be able to walk. They are paralyzed or mute or they can't just walk, or some of them have like gait issues, problems like they can't walk properly and things like that. They usually seek medical help uh, with complaints, other complaints like chest pain, dizziness, headache, swelling, shortness of breath, insomnia, and numbness. And when they get to the hospital and these conditions are not diagnosed, because after running several tests and they didn't find anything wrong with them, the patient feel discounted and they don't trust healthcare providers. So some of them might not even come to the hospital. They might not. They might completely avoid healthcare practitioners because they don't trust them. Uh, and we have different types. There are two types that I will talk about: anxiety, anxiety disorder. It used to be called hypochondriasis. That one is characterized with extreme worry and fear of possibility of having a disease. Some of them seek healthcare, like I said, and some of them may not. And the other one is called conversion disorder. That's like they can have manifestation of neurological symptoms uh, without any diagnosis. Like I said, some of them could become paralyzed. They could become blind or numb. They can feel numb. But the striking conflict is emotional conflict with the distress. Like, you expect that somebody all of a sudden, that is not something that is gradual, is paralyzed, say they can't see. Like, for example, if I'll give an example, if a patient who or a person who has to uh, have I read that in a book, that this person has to have a presentation which was asked by his or her superior, and the outcome of this presentation will determine whether he or she is going to keep her job. And the person prepared very well, but on the day of presentation, the patient said became blind. And the emotional conflict is that there's no distress. The patient doesn't, uh, you know, like concern, like they're blind. They just indifferent. They feel indifferent about it, like, oh, I'm blind, that's it. Those are some of the things that, like, that conversion, like extreme worry or fear or distress, anxiety, is converted to their physical body. So then they don't have any uh, need to be concerned anymore. How do we treat this condition? There's no specified medications for this, but we can actually treat them for the anxiety with medication like benzodiazepine, and of course they will have to consult with mental health, since they usually will go to emergency or their primary care doctors for this complaint. Other things that we can do in adjunct to medications for relaxation or treat their symptoms, like relaxation techniques, like breathing exercise. They can do yoga. They can do even exercise can help them to relax and all that. The other condition I wanted to talk about is DID. DID used to be called multiple personality disorder, and the feature or characteristic of DID is presence of two or more distinct personality disorder. that usually occur recurrently. They take over the behavior of that person. And each of these personality has their own pattern of emotion. The way they see things are different, and also they relate to other people and their environment differently. It is believed that this condition is brought about that by severe sexual, physical, or psychological trauma in childhood. That during that period, the dissociation happens unconsciously. That is, the mind slip out of themselves. Some of these patients will describe themselves as being in a fog, or as being outside of body experience, kind of. The host, who is the person, is usually not aware of this distinct personality, but they might say they find unfamiliar clothing in their closet, or people are calling them by different names, or somebody says, "Oh, I saw you in another state," because during dissociation they can actually travel, and they said the times of switching of personality usually occurs during a stressful time, and sometimes some of them, they also switching can happen during flashbacks to that period of time. A lot of those patients with DID are they are very afraid, and they feel shame towards what has happened to them. So some of the things in taking care of them, when you assess them for suicide, because we don't want them to commit suicide, so we assess them for suicide ideation and make sure they're safe. Assess them also for self-mutilation. And also, they said during the period of a process of integration of the personalities, they can be very painful for patients when they recall all those painful experiences. So we want to be empathetic towards them. We want to, if they are admitted, because they might be admitted because they have suicide ideation or self-mutilate, we need to provide simple routines to lessen their anxiety. Also, each time we meet with them to perform any procedure, we need to confirm the identity of the person we are meeting, and of the patient, orient them to time and place, and also always make sure you document very well, because each of a caregiver might actually meet different personality. So, and also another caution is to not flood like the patient with data, information about the past, because we have to realize that dissociation happens so that the patient can, have to be able to cope. That's why they dissociate, because the level of stress is too high, anxiety is too high. So we don't want to bring about the anxiety by providing them with. We want to let them, progress at their own pace. They will be they are admitted. They will have to go with besides psychiatrists. They will have to do psychotherapies with the therapist. Getting them to talk about what happened to them. Other complementary things that they said they can use in order to help them with their mood and relaxation is they can use hypnotherapy, but that has to be done by somebody who is very knowledgeable in that. But usually it's not done to explore psychological problems, but it's done for patients to be able to relax and cope. And also, you can do exercise therapy, just like the one, all those things I mentioned for somatic, the symptom disorder. There's no medication assigned for DID, but we can manage the symptoms that they have when they are dissociating, or they start to remember all those abuse that they have experienced in the past. And thank you, and that will be the end of today's discussion. Please don't forget to please make comments and like my channel. Thank you.